This dot point on the syllabus seeks to compare the treatment of disease and illness with the prevention. For an effective healthcare model, Australia must have a current focus on seeking early intervention and prevention, as well as finding a treatment and cure for disease and illness. Healthcare expenditure can be defined as the allocation of funding and other economic resources for the provision and consumption of health services. It currently falls into one of four areas: hospital, primary healthcare, other recurrent expenditure, and capital. Prevention and intervention refers to approaches and activities aimed at reducing the likelihood of a disease or disorder that will affect the individual. The purpose of this dot point is to seek early prevention of lifestyle choices so that the Australian population has a lower chance of chronic diseases and illness. Though this is the overall aim, the government should also put aside funds to contribute to finding a cure for those already diagnosed and living with chronic diseases. It does this by focusing on chronic diseases and illness that occur due to risk factors in lifestyle choices in relation to health. Prevention strategies and promotional campaigns have been in place to reduce the risk factors. Some risk factors include smoking, physical inactivity, high alcohol consumption and drug use, and an unhealthy diet. Many preventative strategies have been in place to reduce these risk factors. Some include educating children about positive health behaviours, restrictions on advertisement, legislation, higher taxes on products such as alcohol and tobacco, supportive programs to help people give up addictions, seatbelts in cars, cancer screening programs, and mass immunisations. The World Health Organization have put together a list of best buy policies that have been implemented in primary care settings in all countries. These include reducing the impact of tobacco smoke, including no smoking in public areas, warning about tobacco danger, restrictions on advertisement, tax on tobacco and alcohol, restricting access to alcohol, reducing salt intake, replacing fats and foods, and promoting awareness of good diet and exercise levels. There are also promotional campaigns in place to prevent disease and illness. These include Slip, Slop, Slap, Every Cigarette is Doing You Damage, and Go for 2 and 5. What does this lead to? Early intervention and prevention expenditure has long-term benefits for the Australian society, whereas healthcare expenditure has short-term benefits, such as a cure for those living with the disease. Prevention and early intervention has a long-term impact on the quality of life, life expectancy, as well as decreasing the burden on the healthcare system, making it a healthier workforce, boosting the economy and productivity.